The gentleman from New York, Mr. Bowman, is recognized for 5 minutes.
Thank you so much to Chairwoman Maloney and Rep. Bush for holding this historic hearing. And thank you to all the members of this committee for allowing me to join you today. Thank you also to Rep. Jayapal for her incredible leadership on this issue. More than 27 million adults in the United States today are uninsured. Millions more are underinsured. As a member of Congress, I am more than adequately covered. I can get a checkup anytime I want. If something's wrong, I can get treated on the spot. Those of us who support Medicare for All believe that every single person who lives in this country should have that level of care. It's very simple. If people knew they had exemplary health care, they would go to the doctor more. But as it stands, millions of people often skip preventative and routine care, instead waiting until they are severely ill to seek treatment. Dr. Blackstock, how do these delays in seeking care affect patients?
Senator Bowman, so delays in care result in late or misdiagnoses. They also result in, when a condition is diagnosed, that it's more difficult to treat. It results in higher mortality rates. We know that people who are uninsured have about a 40% higher age-specific mortality risk. And so, access to care is equivalent to your mortality risk. So we need to give people access to care through health insurance so that we can reduce their risk and so they can lead full, healthy lives.
Thank you, Dr. Blackstock. My next question is for Dr. Michener. As you've mentioned already today, people of color are more likely to be uninsured than white people. They are more likely to experience severe medical events or suffer from catastrophic medical debt. As a Black man, I am acutely aware of the specific care needs that Black men have in our society. It is well known, for example, that Black Americans have the highest rates of hypertension, and Black men are least likely to have their high blood pressure controlled. Lack of trust in our current healthcare system is one of the reasons they are not seeking treatment. Dr. Michener, how could we rebuild that trust under a Medicare for All system with universal access to comprehensive healthcare? How could Medicare for All strengthen communities of color generally and improve other social determinants of health?
I think that Medicare for All contributes to and can contribute to precisely this problem of lack of trust. We can think about lack of trust as sort of an individual attitude, right? But it's rooted in experiences with structures. So when you go to the doctor, or you try to go to the doctor and you're not able to get access, or when you're worried about whether when you show up, you'll be able to see someone given your health insurance status, when you're worried about the cost. These are experiences that are disproportionately occurring in communities of color, and they all erode trust. Over and above that, Medicare for All, a universal coverage system, is going to strengthen the healthcare system more generally. It's going to allow us to make investments in the healthcare workforce. Again, this will increase access in ways that, if designed right, can disproportionately benefit the very communities of colors that are disproportionately harmed by the current system. All of these things contribute to repairing what, frankly, is broken and has always been broken.
Thank you so much for those responses. I want to briefly share a personal story. Just recently, maybe a month or so ago, I was feeling unwell in my office on the Capitol. I literally took a 10-minute walk to the healthcare unit on the Capitol, was seen immediately, treated immediately, and sent on my way to go home and take care of myself. It made me think of all the Black men and people of color and uninsured and underinsured people in this country who do not have that privilege and do not have that access. When they don't feel well at home, they have to just deal with it in whatever way they can using home remedies, which is okay. But imagine they can walk right downstairs or take a 5 to 10 minute walk to a doctor right down the street. get seen on the spot, be treated on the spot, and been sent on their way with the medication or care that they needed. And also, by the way, have unlimited access for follow-up. I can call a doctor on the Capitol 24 hours a day and weekends to follow up on the care that I received. Everyone in this country deserves that level of care. Thank you, and I yield back.